Okay, it's 6:30. We're going to call this HHS meeting to order, May 12th at 6:30 PM. I'm the county clerk, and I'm going to do this meeting until we run through these elections. Okay. Let's do roll call. Kay Wilson. Jim Miller. John Minto. Chuck Van Netten is excused. Jeff Haney. Lorraine Gauger. Don Pettit.
Here.
Pam Mueller. Dr. Dunlap. You have a quorum. Okay, please rise for the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
This meeting was noticed to the news media and public as required by Section 19.84 of the Wisconsin statutes. And now we are going to do the election of the chair and vice chair of the HHS committee. You all have ballots. This election is by secret ballot. I will now open the floor for nominations for the position of chair of the HHS committee. Do I have any nominations?
Kay Wilson.
Okay, we have a nomination for Kay Wilson by Jeff Haney. We don't need a second. Are there any other nominations? Okay, hearing none, you may proceed to vote. Okay, Kay Wilson is elected chair of HHS unanimously. Okay, and now we are going to nominate a vice chair. Are there any nominations for vice chair of the HHS committee?
I'll nominate / railroad Chuck Van Etten.
Chuck Van Netten isn't here, and he didn't indicate whether he would accept that nomination or not. I don't know what to do about that. He's not here to speak for himself. He's not online, no. So, okay,
Was he the last
all right,
vice chair?
let's just, we'll proceed. Okay, so we have Chuck Van Etten was nominated by Mr. Miller. Do I have any other nominations for vice chair? Okay, hearing none then, you may proceed to vote.
I just figured he was next to you, so he should be.
Okay, the ballots have been counted, and Chuck Van Netten is the committee vice chair of HHS. And I will now turn the meeting over to Chair Kay Wilson.
Thank you very much for leading us in the election and the beginning of our meeting. The agenda is available and has been set. Are there any public comments online? No. Okay. Let's move on to number 9. Consider approval of minutes from the previous meeting of April 6th.
Second, Miller.
A motion's been made and seconded to approve the minutes from April 6th. Any discussion? All in favor?
Aye.
Opposed? So carried. So number 10, it's something that we discussed in our last committee appointment about the meeting date and time. Julia, would you like to talk about that?
Sure. The board members have come forward and would like to have an earlier meeting time. The date of Tuesday did not work well for Kay before, but I don't know what meetings you're on now.
Hopefully the same,
Okay, so you would still have a meeting
at 4:30
At
on
4
Tuesday.
Okay.
Yep.
And I think Lorraine tends to have a conflict and ends up coming late too because she has another meeting. So we could do, there's openings in the schedule. I think Mike and I looked at it like we could do a Monday. Or we could do it on the same day, I think, of economic development. Is that a Thursday? Oh, that's Monday. The Thursday, maybe it's public safety. That evening or that day of that, because that's at 9 o'clock and there's no other committees that I saw on the calendar.
Are those both the second Monday and the second Thursday of the month?
It's the first
It's the
Thursday.
first Thursday, and actually, I think the language is it's 2 weeks prior to county board. So it sometimes is the last Thursday of the previous month.
Oh, is that how that ended up
Yeah,
happening?
there have been a few
Okay.
times we've had it twice in a month.
That's only
same
in
month.
October because of the statutory way the meeting falls in November for the county board, because of the budget. So it happens in October.
Okay.
So Julia, the first Monday
So
has been difficult in the past for
well, it's
your
one day.
reporting.
What we would be doing is one day earlier than this. So today is Tuesday. We would have had it yesterday.
Yeah, but that's the second Monday.
Yeah.
Okay.
My second Mondays, I have city council.
Oh.
What,
I guess it depends what people want to do for that. For timing.
well,
I don't
but
know.
would your staff people, they'd be working for their reports?
Yeah, if we did it at noon, well, yeah, they'll be working, so they'll just come to the meeting. They're working now.
Yeah, this would be considered
So
work.
this is considered part of their workday?
Yes,
Correct.
yes.
Okay, I
Yes.
understand. It doesn't matter during the day for me, because I'm retired.
Chuck might be the,
Chuck, would you be available in the afternoon?
like at noon.
Negative.
How early in the evening are you available?
5 o'clock.
Well, we did talk about 5 o'clock, so your staff didn't have to have that hour and a half time
Yeah, and I think Chuck would like 5 o'clock too to get here and get it done, because I've heard him, yeah, he's nodding. I've heard him say that. So it's just picking a day then that we can look. So now we need to kind of go back through, I have
The first Thursday, then?
so if we did it at it ends up being, I'm just kind of trying to see when, did we say that it was public safety?
Yes, it is.
Yeah. So that'd be a Thursday, and I don't know how it reads in the thing. 2 weeks prior, that's how it reads. 2 weeks, 2 Thursdays before the county board is how that reads. So that's why sometimes it ends up being 2. So a Thursday, basically it's most of the time the first Thursday of the month.
First Thursday works for me.
Jeff?
I got a public safety in the morning, so I'll have to drive back and forth twice one day.
Yeah, I have to do that on Wednesdays.
Mondays, that is no good, right?
He's busy on Monday.
Yeah, the second Monday I have a city council. The first Monday I'm okay.
Well, that's a potential too.
Yeah, I can't do the second or third because I have other.
What about for your staff putting together reports?
Yeah, well, it'll be tight, probably more tight on fiscal.
Fiscal is doing 2 months prior though, so they should be okay. I don't want to speak for them, but.
Yeah. Yes, the close would happen, so that would be, and actually, most of our stuff, we backed off so that we're not button up so tight to get a report, because really those reports go in a week and a half before the board meeting, so.
I can't do the first Monday if I'm on Callahan Mud Lake, that's the first Monday. So that's off. Never mind.
How about that first Thursday? Is there any?
I think we're back to the first Thursday.
What was the conflict? Oh, the conflict was just driving back and forth,
Oh.
okay.
Stay in town. Chuck, is the first Thursday of the month, is that convenient for you for a meeting at 5?
Yes. Yes.
Pam?
Does it make any difference on yours?
Sabrina?
So the next one would be June 4th, is that correct?
So 5 o'clock is okay with you, Sabrina?
Yeah, it's the day I'm not in clinic, so it's
Oh,
nothing better I'd like to do than to come here.
you could come in your gardening clothes, you know.
Okay, so we are going with at the same day as public safety, basically, at 5 o'clock. So if you're looking in the calendar, we'll get that rearranged.
So do we need a motion for that?
So technically then it's 2 Thursdays prior to the board meeting,
Yeah, I
not
think that-
first
Right,
Thursday.
right.
Yes, it'll read, let's see, I will just try to get into,
Because the
public
board meeting is always
safety
the third, right?
reads
The third
as, oh, not,
Right.
it's the second Thursday before the county board meeting. I know that sounds weird, but that's how it,
Okay.
Can I ask for multiple reminders
yeah.
about the change?
So the schedule is out there a year in advance, and it's, all the agendas are already all there on the calendar online, and also the whole staff, 200, 300 people have the calendar with the wrong dates on it now, so I'm gonna have to redo all of that, but there's another committee we're changing maybe too, so I'm just gonna do it all at once.
Okay.
But if there's a bunch of mistakes, it'll be my fault, probably.
Oh,
So do we need a motion for that, to change the
I'll make a motion.
meeting to 2 Thursdays before the county board meeting at 5 o'clock, right?
correct.
I'll second that.
Motion's been made and seconded to what I just said. Any further discussion? All in favor?
Aye.
Opposed? So carried. And Chuck, congratulations, you're vice chair of this committee.
Oh, am I?
Yeah, how does that sound?
What happens when you don't show
You were voted
Oh, you're muted.
When does this happen?
today.
Oh,
You weren't here yet, so lucky you.
I got the wrong link.
All right, let's move on to
Okay.
no LCO report. Senior citizen report, is there,
Okay.
senior resource center report, rather?
There's a written report attached from Joey.
All right.
So the Senior Resource Center has this May report from Joey Johnson. Everything's good over there, and the big thing happening is there's an open house there, May 15th, from 5 to 7, a brat fry. Ron Buckholz will be there grilling, and other people on that board.
Okay. Let me just take a look here.
Are they applying for a grant? There's the IRA and Aniva Riley Baldwin, Wisconsin IDEA Endowment Grant. Or did they get it? Okay.
They got it, looks like. So any questions about the report from Joey? We thank her for that. Let's move on to administration. I'll turn it over to Julia.
Okay. Standard in the administration report is the acronyms and terms and glossaries. So Mr. Miller, that might be helpful for you as you move forward, or you might not know enough about all these different areas, but it was a request that was put out.
By me, who knew none of them.
So we just keep it in there. And then I also did add the bylaws in so that you can take a review of those. As we're kind of looking through those, I think there may be some changes that you guys might decide to make as you move forward, and we can make some recommendations as well. So maybe next month we can bring that forward. So if there are any specific changes that you would like us to redline in there, just let me know.
So make sure that you have a chance to read those bylaws by next meeting, please.
Is that just a routine review? Or is there something?
There's some things in there about needing to be in person to every meeting and ability to vote, and maybe some other things in there that you might think, that's really not how we're doing things. The next thing in the packet is the org chart, which is standard, and we're keeping that in there every month. Carol Martin, I had noted, is retiring. Her last day is June 1st. We did actually have interviews, and we do have a replacement. Ashley Miller will be starting on May 26th. So we will have somebody in place right away. She'll have a learning curve, obviously, as she moves into the position. Ashley is a certified social worker, comes to us as a previous employee of HHS. She worked in our CPS department. And then of most recent, she's been working with the elderly and has a passion for that, and will be coming back to us and working in the APS ADRC world. So excited for that. Joni Zeckerl had her last day probably a couple weeks ago now. We do have that position posted. We have not interviewed for that, and that is for the regional dementia care specialists and information and assistance. So those are the changes happening in the aging and disability area. In the business services, we're having changes as well. So, and partly maybe we go to economic support, partly because Allison Larson took a new position outside of the agency. And Tanya Richards, who was working in the business office, has applied for and accepted the position of economic support specialist. So she'll be transitioning on June 1st. We had recently hired Brittany Carroll to replace Mel, who retired. We got lots of changes. And because our interviews were so recent to that, it worked out really well. Nikki Paul was another person that we had to think hard on who to hire. So we were able to call her back, and we have her hired and brought in. Her first day was yesterday. So hopefully we'll have a good transition there. As you can see in the Health and Human Services Board, I added Jim and John in as supervisors, and now we'll need to get updated that Chuck is now our vice chair of the committee. Let's see, other things that we have going on. In behavioral health, as you know, Joe has been helping out. He now is also doing OWI assessments. We talked about that earlier, talking about whether we would contract out for that or do it internally. And I think he's probably even done 4 already. I'm not quite sure. We're still hiring up on transition so that we can bring our client back. Our goal is June 1st. We're going to be super tight on that. I'm hoping to have interviews at the end of this week. And in public health, Nathan Stafford is coming in as a limited term employee for an environmental health technician, and he started on April 13th. I don't know why I can remember that date, but I can. So lots of changes happening in the area. The other thing that is happening when we think about the admin update is that we are having our all-staff meeting tomorrow. So doing a lot of prepping to get ready for that. What we have been hearing is with the newer staff and some of the different things that are happening within the agency, a lot of times it's easy to get siloed and not really know who's doing what or how do I connect to those resources. So tomorrow will be all about connectedness and working on what's happening throughout the organization. How do we make referrals? How do you connect with people? And really trying to get to know others that you don't necessarily talk to all the time or see all the time. We have around 50 employees, so sometimes people never see one another, and we have people that work in a whole nother office building and people who work straight from home. So it should be a good day. I included in standard the strategic plan. And I am just going to jump down to, with that employee engagement and retention, tomorrow is one of those big days of that connectedness. Looking at the electronic health record, we continue to add more forms in there. And we have started working on the centralized referral process. Carrie we're actually going to create an online form for a referral, so they can go in and they can click, you can self-refer or refer from an outside agency. It'll pop in to an email to us, and then every Tuesday we're meeting as a team to go through all of the referrals, determine where's the best place for that, sometimes just talking through what are the issues, and trying to really streamline getting people into services quicker. Uh-oh, now my computer. I just spoke about just needing that final hiring, and we'll be able to bring our high-cost client back, which is what that one is. And then revenue streams. Allison is just about done with her training. She'll be done by the end of this week. So she'll be CCS. She's on the roster. We'll be looking at all of those CCS clients and bringing them on board. Okay, I think that covers my admin report. Any questions or?
Excellent.
Okay.
Moving on to number 13, Aging and Disability Resource Center.
Okay, we are going to be working on getting some other data pulled in. There's a new reporting mechanism that they're reporting their data and doing different things into. I'll be working with the regional director to learn how to do that with Ashley, our new supervisor. So we should have a little bit more data through, but did want to include information on the ADRC in all the different areas within there for everybody's update.
All right, behavioral health. We have a report.
We have a report from Alicia.
Is she here?
I don't know. I can't tell who's.
Yes, I am. I am here.
Oh, okay. Do you have any updates since you wrote this report? I didn't see anything, but I didn't know if there.
No, I don't think really there's anything more that's been anything that's changed since this was written. We are waiting, for Allison to be, she should be done with the rest of that training this week. And then we have to get Joe recertified with Medicaid just because he was gone in 2025.
And I did check on that today. And we are it's sitting in the Medicaid waiting for it to just be approved. So just wanted to make sure that we're all, it's not that we haven't done it, it's just waiting for that.
Wait, for them to read. Yeah, they're not always quick on their responses with things. Let's see. We did have a really good meeting with our DQA surveyor because we have a different one for the first time in many years, looking at, because there's been so many programmatic changes throughout 75, 35, 36, all of them. And then with the introduction of an electronic health record system, we weren't sure how that would look when we have our recertification this year. But at least we were given some good guidance related to that. So kind of lessens the anxiety when that comes up. Things, overall things are moving forward and, just with a lot of changes, it's set things back, but we are, looking forward to getting Allison certified. Joe is on board. I'm certified. We'll be able to, hopefully get one person on. I'm thinking, this month, keeping my fingers crossed. I got more information on some of those names you gave me, Julia, today from Caitlin. So we're working together on that. Things are moving in the right direction finally. So.
Okay, thank you.
Do you have any people that are ready for CCS?
So it's not so much like being ready. What we have to do is we have to perform a functional screen to determine eligibility. So they have to have Medicaid. That's the first. It can't be any other type of insurance. It can only be Medicaid. And then we have to reach out to them. It's a voluntary program. So if they are not willing to sign a release for us to get any documentation, information from their mental health providers, substance use disorder providers, we can't place them or go through that functional screen. If a person does agree to participate and signs releases of information, we start gathering that information, and then we will conduct a functional screen, which determines the eligibility. We fill in all the information, hit the submit button, and within 35 seconds, we get an answer back on a screen, which determines which programs they're eligible for.
So are there people that you have,
There's 4 or 5.
that you're ready to assess?
Yes, that we will be following up on seeing if they are interested in, and then we will start with one person at a time, because for each individual that goes on, we only have 30 days to get every piece of that, the requirements in Chapter 36 met. So it's not, there's a lot that goes along with CCS, so we will take one at a time. But yes, we have 4 individuals right now that we're looking at. I will start reaching out tomorrow to the one person I believe would be most likely to screen eligible and the quickest.
Great, thank you.
Yes, absolutely.
Okay, anything else that you'd like to report?
No, I think everything is in
Okay,
a,
all right, thank you.
yes.
Let's move on to community support and mobile crisis.
Is Caitlin on?
Yes, I am here.
Caitlin, you guys have been busy. Caitlin also is involved in our central referral process, so she's on with us every Tuesday. It's been helpful because and I'll let you speak in a second. It's been helpful because when she has mobile crisis, they do linkage and follow-up for 30 days. So on some of these, if they didn't have services already in place, this is how we're like looking, especially at these clients, being more likely to be a better fit for CCS versus like if there's an emergency commitment or there's a severe mental health going on there, then they're a better fit for CSP. But quite a few that we encounter on mobile crisis would be a good fit for CCS. So go ahead. I'll let you speak to what you got going on, Caitlin.
Yeah, the CSP kind of remains the study amount. We've been sticking around that 45-ish consumers in the program pretty consistently over the past year, I would say. The majority of them are voluntary, just 9 people on court orders for the program right now. And we've had one case manager on medical leave, so that's caused some strain, but they are thankfully coming back. And then mobile crisis, we've just seen kind of a pretty steady increase, I would say, in March, and then that carried into April as well, where we did 4 emergency detentions in March, where before we were trying our best to do kind of safety planning and a voluntary engagement. So we did have 1 Winnebago admission that month.
Caitlin and her team have been working really hard to try to get people when they do need to be placed in areas that Medicaid will cover. As we talked about, Winnebago is considered an IMD, which has over 16 beds in it. And so right now Medicaid doesn't cover there and it does not cover at Willow Creek. However, if they're kids, their Medicare does stay in place. So anybody under 18, that is covered. And just as a reminder, the state did put in a waiver for the Medicaid waiver so that it would cover at Winnebago or any IMD in Wisconsin. They are still hoping that we will be hearing by summer, fall-ish. We don't know for sure, but that will have a great impact for us.
So where do these emergency consultation calls come into?
Do you want to talk about how the process works, Caitlin?
Yeah, so the consultation calls, I answer all of them personally. They come from law enforcement, and typically they're, out in the field at somebody's house, there for maybe a welfare check, or, they call because somebody appears to be maybe having a psychiatric emergency when they've come into contact with them. And so if I can kind of help resolve the situation over the phone without having to fully do an assessment in person, I will do that, kind of just pointing people in the direction of resources and talking about, how to keep people safe at home. If that's not possible, then the officer will bring them into the emergency department for a face-to-face mental health evaluation, where we come up with a plan of either going to a behavioral health unit or doing outpatient referrals and coming up with safety planning at home.
So Caitlin, is this 24/7 for you?
Yes.
Thank you.
Yeah, it varies quite a bit. So I will say typically the county, I thought March was pretty busy from what we had been seeing. So usually it's not too bad. Usually, the law enforcement officers and I have a pretty good system where they know when to call and when not to. So thankfully it doesn't get too burdensome, knock on wood.
Yeah, be careful what you say.
Right.
All right, thank you. Anything else?
Nope, that's it.
All right. Mental health expense report.
Yep, we have the expense report and the cost by client report, our standard reports that are in there. Winnebago is going to be looking higher because we don't have that client in Limitless, and we didn't, on this report, didn't include that to kind of make that shift. So we should have added money into the Winnebago annual projection. So when that client then comes into transitions, then we'll see a good cost reduction there. So she's ready. She's been doing quite well. We just need to have our staffing ready to go and pull that trigger and get her home. So have a meeting. We're trying to work on a meeting with law enforcement and with the hospital, so that everybody is prepared and ready, because we know that there will be some hiccups along the way, and she will most likely end up in our emergency department. Goal is to, if we do have to send her to Winnebago for some reason, that we just bounce her right back, because we actually have a stable place to bring her. So
that's client B.
that's probably client B. Okay. Yes. Client C is already gone. Client B. Yep, you're right. Client C is already gone. Client D should be moving into a less restrictive area, and costs should be going down on that. We're also looking to see what other, because that client is turning 65, what does that kind of look like, and are there some other alternatives?
So when client C moves out of the county, then we are done with that responsibility? Okay. So. All right, let's move on to Child Protective Services. Okay, things are going pretty well in the area. Caseloads are, and again, you don't want to say this too loud, but I'm seeing everybody just take a little breather right now. It seems to be like actually where things are manageable, whereas 2-3 months ago when I was talking with their supervisor, she was just like, they are like at their wits' end to be able to manage things. So let's hope that some of those kind of continue to stay the way they are. Our ongoing cases are dropping. Because we're getting some of this kind of backlog that we had in our system, getting kids put into permanency. So then they're coming off of our caseload, which is a good thing for everybody, good thing for our staff, and a really, really, really good thing for those kids to have permanency. So nothing crazy to report in that area at the moment. Let's move on to youth justice.
I thought I saw Sarah on.
Yep, I'm here. Can you hear me?
Yes, we can.
Okay. So in addition to the numbers, I do have a few things just to touch on. But as you can see, our referrals are staying pretty low. I mean, knock on wood, kind of like Julia said. But it does feel like things are coming together, like we have full-time staff that are fully trained, where they're fairly self-reliant for the most part, and they're able to just kind of move through the day without a lot of questions and guidance from me. So that has been really good, really exciting. And we are continuing to see the caseload numbers slowly decrease. We all certainly hope that this is a sign of, where we're going, but I think the real test will be this summer to see what kind of referrals we get. And then I'll feel, a little bit more confident in saying how I feel one way or another. What I can say is that I'm really proud of the new diversion program, the work that's being done. And I will touch on diversion updates in just a second, but I wanted to first talk about the YJ caseloads. We have Amy Thompson, who is our foster care kinship worker, who along the way has been the person to pick up kind of the overflow of youth justice cases when it wasn't manageable for the 2 full-time ongoing staff that we have. But exciting to say that Amy is going to be down to only 2 cases within the next month. I am slowly working on transitioning her more so out of YJ so that she can focus on her foster kinship role while assisting with any overflow in CPS when needed. And then with Melinda Oyos being in diversion and it just makes most sense for her to kind of pick up any of the overflow in YJ if needed, since the diversion and YJ work kind of overlap and it's the same kids that we tend to be working with or their families. So she's just very much in the middle of all of it. So with diversion, we are almost through our first year of this new program and making notable progress and feels like success within, the role of working with students in the schools. I will have more of a big presentation next month that really outlines more of the totality of what the school year looked like, the statistics, and then I will also have feedback from families that we've worked with and as well as our school partners. So at this point, if you're looking at the different numbers, if you flip to the next slide, I think it is, yeah. So in this, you can see that we still have 8 youth that are at 100% attendance for the school year, which I think is remarkable. At this point in time, 64% of youth who we have enrolled in diversion have an 80% or higher attendance rate. Right now, we are measuring success by looking at the program involved youth who were last year very minimally engaged in school, and many of them were close to being considered a dropout status. At this point, my department we're not able to file GIPS petitions, which what that would mean is for our kids or families that aren't as in compliance as we would like to see them. So the ones that are under 50% attendance, we would like to have the ability to bring those cases to court. I am currently working with the judges on adjusting or amending our local statutes to allow my department to file the GIPS petition within the court, which is not the case right now. It is right now, the way it reads, it has to be the DA's office or our corporation counsel. And it seems as though the DA's office is kind of overwhelmed with what they have going on right now. And it would cost the county, I'm not exactly sure how much, but there would be costs associated with using corporation counsel. So we're trying to avoid that as well. I think for the time being, we're able to kind of get through this for the most part and just hang on until we can get that local statute amended. But in talking to the judges, it sounds like that could take up to a year to be able to accomplish. So just kind of giving the heads up on that. We have also seen a lot of success with our our family support groups that we've implemented through additional grant funding. We are partnering with Journey Day Treatment on this. I think I've talked a little bit about this in the past. We are kind of in the middle of our spring parenting group, which is 12 weeks long. We are pretty excited now to have families reaching out to us because of the word of mouth of the interactions and what our families are currently getting out of these programs, and they're finding it to be worthwhile. So now, we thought that all the families that we would have involved in this program would have to be court ordered because there wouldn't be many, people excited. This is hard work, and it's a lot of deep digging into family dynamics and past trauma and really working through those things with the caregivers as well as the youth. So we are really happy with the feedback that families are finding it very useful. We continue to be excited about these new programs and having such a huge impact so soon. And we're looking forward to continuing to watch these programs have a dynamic impact in our community as the time goes on. And, there more and more months or years go by with the implementation just to see the full effect of what kind of change we're making. Any questions for me?
Sarah, I was wondering, on your under 50%, you have 7 students in that group. What is the age grouping for those 7 kids?
I would have to break that down a little bit further, so I don't have that information tonight. But when I
Okay.
do that bigger report, I could break it down a little bit more.
Okay, I would just be interested in, I guess, all of those 60, 50, under 50.
Yeah, I can do that.
Thanks. Good job. Great.
Thank you.
Any kids that we can keep in school are future good citizens. Children's Support Services.
Okay. I'm just going to have Haley come stand up at the podium. So Haley Sands is our new Children's Support Services Supervisor. So she has birth to 3 and children's long-term support. And I just wanted, you can add anything that you want to your report or talk, or just, I know that people are just going to want to say hi and see who's the face in here, so.
Yes, so I am new to this role. It's been a really exciting challenge, kind of getting things where I want them to be. But really at this time, we are doing really well with enrollments. We're seeing a lot of new referrals coming in. So I think having 60 enrolled children for the month of March is actually doing really well, given that we have 2 full-time CLTS service and support coordinators as well. Then I'm taking on some of those clients too. I did include in this report the enrollment timelines, so that's a good comparison for how we are doing with the other counties in the state. So we are doing really well actually keeping up with that. So we are in compliance, which is something, because when we receive a referral, we have 10 days to contact them. And then from the data referral, we have 45 days to complete a functional screen. If they screen eligible, then we have to get them enrolled. So we have another 45 days to pursue that enrollment, and then 60 days from the date of enrollment to get the ISP done. So that's their individualized service plan, so what they want to do on CLTS. So it is quite a bit to kind of throw into your daily mix, but we are getting them in there and keeping up with research and everything like that. For birth to 3, I haven't really jumped into that yet, but Jen is doing a great job with keeping up with everyone that's enrolled and managing all those referrals. She is actually planning the Wilderness Walk Playgroup at this time, so that is a good experience for families who've been involved in birth to 3. So we'll invite people from 2025 and then also 2026 to engage with others and communicate in a fun environment. So it should be a really good time. It'll be my first experience going to it, so.
And that's an annual event that we do, and LCO helps support us financially on that, and it works out really good. People tend to connect and then have somebody that they can lean into afterwards, so people with the same experiences.
Any questions?
Do your referrals come from the primary care provider?
Yep, we do get referrals from physicians. We also, a lot of them come from the schools, but we also see quite a few from youth justice and CPS depending on the needs. So they do come from quite a few places. And Birth to 3 is a good referral source too. So we kind of see them starting with Birth to 3 and then jumping into CLTS too.
I was going to ask where your referrals for the CLTS program came from. Is that what you were referring to, or the Birth to 3?
All of it.
Okay.
Yeah.
Yeah, and with Birth to 3, we get a lot of referrals from physicians, but then there's also daycares and parents calling too. So not quite as diverse, but they're a younger age group, so it is a little bit more contained.
And the one thing that we just had a meeting, and the one thing that we've noted is that we're getting kids in younger to Birth to 3, which is great, but it does change the dynamic in the caseload, because when you're getting them in at 1.5 and then they're moving on at age 3, you're kind of in that cycling through. So now when we're getting them on and we're keeping them on and then we're continuing to get those referrals, I do expect to see these numbers continue to go up into that program, so.
Don't I remember from an earlier report that we didn't have any in Birth to 3?
No. I had said that we just had a reduction, and we didn't have a lot of, I shouldn't even said that loud. We did have a whole lot of referrals waiting, but now we have 11 in there. So, and those are hard to keep up with and make those connections with too, so.
Well, enjoy your new job.
Thank you.
Thank you, Haley.
Economic support.
Is Shauna on?
I saw her name.
Yes, I came back a day early, so.
Shauna, got any updates for us?
Things are staying pretty consistent with the food share cases and Badger Care cases. I usually kind of read through these, but we haven't really had much change. It's, varies just by a handful of cases each month, at least at this point. So I kind of just wanted to highlight a couple of our successes. I got information out today from our consortium administrator that for this last month, we had the best wait time in our call center. So even though, something like 39 minutes seems like a lot, we had the best time in the state. And so we're proud of that. We're committed to customer service, and I think that reflects that. Then we also had our management evaluation review for our food share program, and I'll be enclosing that report next month with your packet. But again, just really proud of the work the Northern Income Maintenance Consortium has done in this period of time, which was October 2024 through September 2025. And this is area of focus with funding is the active error rate. So our active rate for that period of time for Northern was 4.88%. And for the state, it was 8.03%. This isn't on the report, I'm sorry, but it's hot off the press. We just had the review here in May. These reports are always behind as we get the information. But again, kudos to our consortium, to our Sawyer County staff administering economic support programs. We had 41 cases pulled. Out of those 41 cases, there were 2 that had an error. Errors typically tend to be in calculation of wages and salaries and shelter and deductions, self-employment income. So that was the active error rate. Then we also have our CAPER error rate. And on that, Northern had 20 cases pulled and we had 0 cases in error. So for the state, they had 784 cases pulled. There were 141 in error. The error rate was 17.98 on those. So again, just really excited to share that news with you and impressed, and hopefully we can continue to have this success.
Excellent.
So one other thing, I have 2 things for economic support. That are, all of your staff went to an all staff, right? You want to speak just briefly on that?
Sure. So it had been, correct me if I'm wrong, Julia, it was pre-COVID. So I think it's been 6 years since we were able to have an all staff meeting. We met in Medford and had a really great day. So we had a luncheon that day. We had a couple presentations. Amy from Ashland County did really just a kind of a smorgasbord of reminders and reviewed best practices. We were able to open it up to staff to ask questions. And then I presented I'm the fraud supervisor for the consortium. So I presented on red flags and best practices for detecting and preventing fraud. So program integrity, and was really well received. I think that it was a relaxed setting. We were able to cover a lot of ground, but did it in a very almost social environment. So I think everybody came away from it feeling really good about the work that they do. Steve, again, presented some of the information on the success and looking at how well we do as far as keeping our errors down, and some of the plans that we have in place moving forward to continue to have that success. So really good. We all piled into one car, myself and the economic support team, and it was the best feedback that I've ever received from going to an all-staff meeting. So some people like meeting together like this, and some people would rather do a Zoom meeting or just receive the information in an email format. So I was really happy to hear that my staff enjoyed the day.
Thank you. Yeah, it was one of the consortium, all of the directors kind of, run the budget and make decisions and those types of things. And we just strongly felt that an all staff meeting was really important right now, especially with all the changes that are happening, and will continue to happen, and it helps them be able to reach out and connect. And we saw a lot of emails of gratitude for being able to do that. So very happy for that. Thank you. And then the other thing that we have going on that we'll probably have more information on by next month is that the funding from the state came through so that we can hire for quality assurance within the programs. And I'm thinking that it's a potential of 5 employees for the consortium. I'm not exactly certain. I know Shauna is going to get a little bit more information on that tomorrow. And we have a meeting, I think, next week with the directors. So I'll find out a little bit more regarding that and what that'll look like. Do you have anything else right now that came up that you wanted to say towards that?
No, what that looks like so far from the planning meetings that I've been involved with is we're looking at a lead worker and then 3 to 4 quality assurance reviewers. So, and hopeful that somebody from Sawyer County will be interested in maybe filling one of those positions. I think that we have some really excellent workers. We've got a couple workers who have been doing this for quite a while. So I'm hopeful that we'll get somebody here from Sawyer to take one of those positions.
Okay.
Thank you.
Thanks.
Let's move on to public health.
Good evening. I'm Julie McCullum, Health Officer. My report is in your written packet. My written report is there. Just to highlight, MRC, April was National Volunteer Month, and we have a wonderful core of people in our Medical Reserve Corps who volunteer and do everything from public health education to helping us with clinics to providing disaster care in an emergency setting. So we're grateful to have our MRC. Also, you'll note that in the report, I put in our annual report. So it's our public health annual report. It is a requirement from the state for each public health department to submit an annual report. And so this is just the year in review. So I use the Foundational Public Health Services Framework as a model. And you'll see everything from our communicable disease follow-up to chronic disease and injury prevention, environmental public health services, as well as maternal and family and child health, and access to and linkage to care. So if there are any questions, I'm happy to take them. Okay, thank you.
Thank you. Fiscal.
Okay, there are just a couple of areas that I want to call out that we are having higher expenses on than expected, and that is for sure in the ADRC area under client expenses. We have had placements under Chapter 55, and we had not had any placements for a few years. Those placements started at the fall of last year, so we didn't have anything in budget projections to put any funding into that. So hopefully we will start recovering some of the funding that we spent last year. We're working on recovery, so when people get their guardian in place and they have that fiscal agent there selling properties and those types of things, then we are able to put a lien in and be able to get payment back. So that is one of the areas that is standing out to me right now that we're really focused in on. We've been, our legal fees, I'm guessing, are gonna be higher in that area than what we have seen in the past as well. We have been in court a lot lately. So between the 51s and the 55s, I think last week I spent at least 20 hours sitting in the courtroom. So it's been a handful, but some of those were coming to conclusion and moving into Inclusa and those types of things. So hopefully that settles down a little bit. However, I think it was last week or the week before, Rebecca noted that she had 7 APS referrals in 1 week. That's a lot of referrals for the department. Other areas are looking pretty good. I want to jump to, if we can jump into the purchase service recap. As we're looking through, just a reminder when some things aren't budgeted, we say funds available, that means a grant came in or we have funding that became available. And so it sometimes looks like we overspent, but it's just money that wasn't budgeted that came in for us. So especially like you'll see in the other, if you go down to family services, other family services grants, some of these one-time grants come through to us, and that's kind of how that's projected. So just wanted to show that for you. And when it comes to receipt recap, it's a little early in the year. We're still, it takes a little bit for insurance claims and for things to go through GEARS, which is one of the ways that we get our funding back from the state. And also when we're part of consortia, they're always a few months behind on those payments. So little early to be really diving into where we are on receipt. But from everything that I've been hearing on how things are going, I'm not hearing any major changes in funding streams, so.
So when it comes to budgeting for next year.
Yeah, what we do, so we'll be starting that budgeting process. So what we typically do is take I think you usually you give us the last 6 months. A lot of times what I will do, I tend to go back and go 12 months, so I get that full range, just because some things are cyclical in our department, and I think having a fuller number of months helps us to be able to get a better projection. So obviously, we will be projecting some 55s and some placements at Clark County.
So what do you think, why this explosion in that area?
We have, I don't know why people want to move up here. People want to move up here this is where their vacation homes were, right? And they're selling their places and they're coming and they're living up here. Our population is getting older and older. So that's really what's happening with these 55s. It's people with dementia. It's people that, we're trying to get some of the guardianships in place prior to some of these things happening. But, if families aren't proactive on that, or they don't come up and see their family member, and then all of a sudden they get here and they're like, whoa, things are not looking good. And then they bring them into the hospital. And then from there, that's where we end up getting into those Chapter 55s. So there's a few ways that we're getting people. Some people have been on our radar for a while and we just can't make any movement on them. And then eventually things fall apart enough where we then have to do a 55 because there's no other alternative.
So how do you project for budget?
We just are going to need to go on what have we been seeing over the last 12 months and kind of go with that.
Okay.
It might be our new norm. Maybe we had a few, just like with YJ, maybe we had, a few things that were sitting out there and we just needed to get on top of them and things will get cleaned up a little bit more. But I would expect, just based on everything that we've been hearing, when we see those WCA reports coming through and what the expectations are, these northern counties are going to be hit fairly significantly. So where funding should be placed when we think about the state is thinking about what can we have up in this area for dementia care, like crisis units, to be able to get people supported up in this northern region, because we're going to have more demand for that. So I wish I could spin that any other way, but numbers are numbers.
Yeah. Well, that's your job, budgeting.
Numbers don't lie, you just gotta go with them.
Yeah.
Julie's done a really nice job though, budgeting last year to come into this year, and they're really sticking right to it, a little bit under on the expense side even. And as she mentioned, revenue is harder to track because it always lags by so much, but we're in really good position right now this time of year.
Good, thank you. That's a good news. So do we have any board-appointed committee updates? Do we have any correspondence or reports from meetings? It'll be interesting to hear about your meeting tomorrow.
Yes, yeah, I'm looking forward to that. I can say for conferences that Carrie and I both went to the WICSA conference, which is for kind of the directors of human services. That was great. We got it's nice to be able to tag team and split off, especially when you have those breakout sessions for both of us to be able to get into. Got some good ideas for potentially moving forward with CPS. We'll have a work group started from a bunch of, it's mainly about rural CPS and how can we manage that a little differently? How can we put some different ideas in to be able to help us have better regional coverage? So looking forward to connecting on some of those things. And then a lot about connection, and it was that connectedness and how we need to get into this new world. Post-COVID, we got kind of all in our little buckets and we stayed in our Zoom world, but being able to get out, connect, and talking with people is really helping with the resilience as well. So some of the things that I got from that conference we'll be using tomorrow. So
excellent. Does anyone have some future agenda items that they'd like to have on the list other than our bylaw review? Just regular then?
Regular.
Okay. So.
And due date though, let's get that
I know.
made.
I was looking for my calendar. So what will our new date be? June 4th at 5 o'clock. All right.
Okay.
We'll see you all then. We're adjourned.
Thank you.
Thank you.